Hello everyone, it feels a bit like speed dating up here. My name is Leona Didsbury. I'm a health psychologist. I've worked in primary care for 14 years now in various capacities at ProCare Psychological Services. I'm a self-management educator and consultant, and I now work in a different setting, which I'm going to talk about quickly. And my topic is, can we afford not to do health coaching because our preliminary trials have shown such incredible results, especially people with diabetes. So I've worked for 7 years in what was previously called East Tamaki Healthcare, the primary care service that was developed by Dr. Patel and Mrs. Patel. It is now called Tamaki Health, and we're very large. A lot of you are here from our team, and some of you know me. But we do have a lot of clinics, and we are seeing on average, with all of our clinics, 3,500 people a day. So we have the goal to really perfect the value of those consults and to really help the people that we work with. So my team is an experimental team. When I started at Tamaki Health, we got involved with Kia Kaha with the beyond 20,000 bed days, and then we also stayed in the Manaki Ho'oda campaign. And at that time, it was just myself and another health psychologist, and we were able to create a team because of that support. And one of the things we found in our preliminary PDSAs and our studies was that the major problem in our area, which is Otara in counties Manukau, was engagement. Engaging with the people that needed us the most was a big problem. So we brought 2 peers onto our team, and we changed the way we worked based on their feedback, based on really looking at our people that we were trying to reach. And these were cold calls that we were trying to make of people who are high users of ED and had 2 or more long-term conditions. What we found was we had a remarkable change in engagement rates, and so then we carried on to hire more peers, people who match in language and in culture our people that we work with. So this is our team. Amy's not with us anymore. They have one standing next to me. She's a health psychologist intern. So we always have an intern that myself and Nick, the kind of tallest person in the back, we're both the health psychologists. We're both supervising interns. And there's some other lovely people there that you might recognize here. We're missing Celinda on this one. But our team is unique in that we are all trained to do group self-management work, and we are all trained to do individual self-management work. We all work with people individually and by group every day, at least part of each week, but we also train others to do that, and we are all working in clinics. I'm just going to show you this video, if it'll work for us. There we go.
I eat vegetable now more than what I had before.
My goal weight is 100.
They're looking at you and they notice changes.
Health coaching is really around a set of things that help the people to take greater charge of their health. Here in South Auckland, we're serving an incredibly diverse community with very large Pacific populations, Maori, South Asian. So we have to respond to that if we want to be effective.
I saw that health coaching have helped me as a patient, has made it easier for me to talk to someone about my condition, and I thought that training to be a health coach would be really great in order for young people like me with going through the same thing as me, having diabetes at a young age.
It's a great idea to me that I have get ideas and help from other people. On the last 5-7 days, I have taken 6 kg off. They cut my food down. Dropped down to half of the plate that I used to have before.
He has done as an action plan working with the health coach. So those little changes has made his HbA1c drop.
You can see the difference it makes in people's life. You can see the changes that it brings in them, the happiness, and seeing a smile on a face coming in to see you is amazing.
My HB level was at 80. I was quite surprised, but it dropped all the way down to 52. I was really happy.
Seeing them being more active and coming in, telling you what they've been doing compared to how they've been in the past, those are the major things that come up.
Otara's blessed with a shopping centre. Look, it's open, and when it's raining, you can do your exercise around. When I first started, I walked 2.5 kilometres at my heaviest, and I was puffing. I'm doing 2.5 kilometres now, and I'm at 145. It's a breeze.
We think that the benefits not only for the health sector in terms of reduced future needs from the expensive bits of the health service like the secondary and tertiary part, but also actually for the wider community in terms of more people working and not being on a sickness benefit and so on, are such that it will be great to see this delivered as part of normal care.
I feel strong like a young fella.
The way I look, they're not used to seeing me as skinny as.
People are saying, eat the cream cake. Oh, here's a banana cake. And I say to them, this is my answer to them. I'm in training.
So anyway, those are some good stories. And Joel, who was at the end there, he was sent to us. He actually isn't one of our patients, but he was sent to us by the specialist nurse or social worker at Counties Manukau because he was in line for a bariatric surgery. But to date, he's lost 50 kilograms, and it was mainly just through going to one of our self-management programs and actually having a health coach. We were the rest of the slides are really about MDCIP. How many people here know about MDCIP or were in it? Yeah. Modified Diabetes Care Improvement Plan, which was, we were given some funding and some support to do some specialized work with people with over 75 HbA1c in Counties Manukau. And so we had basically a list, a cold calling list, and we worked with those people specifically. And the key point in everything that we're doing is who's really in charge, okay? Who's really in charge of their health, especially with diabetes? It's really the patient. We, as health professionals, we often think we have so much control. We do when someone's being wheeled into the emergency department and someone decides which surgery they're going to need. For acute care, we are definitely in control, but long-term conditions, it's really the patient's walk that is going to make all the difference, and what makes a difference is when they know how to use what we have to give them. And this is what we're doing at the moment. We're doing several small trials with health coaching for diabetes specifically, because every clinic in our company, they say we want help with diabetes. And so that's where we're focusing, but the health coaching model that we're using can be used with any long-term condition. And we don't differentiate much between mental and physical health long-term conditions. That's part of our team. So you can see this team here, some of those people are here today, and that is a nurse-led clinic supported by a health coach. And our goals in the beginning were to reduce HbA1c by 10%. And we used the tool that's based on the CEPC model of health coaching, which I'm a trainer in, which Nibby was talking about, from San Francisco, University of California at San Francisco. And the key thing is the health meets the patient before the clinician and after the clinician, which has been mentioned. And these are the micro skills, the health coaching micro skills that the coach uses. And then the coach also knows how to connect people to anything outside of the clinic that's going to be helpful. And one of our questions was, will GPs like it? Well, actually, GPs love it. In fact, we would like to be able to respond to all the GPs that want us to come work with them. And also the thing is that it is a clinic setting. It's not just another like community social worker or support worker. We work in the clinic. We become part of the clinical team. Patients like it, average response 4.5 out of 5. And these are some of our results. I know everyone here is a result person. This is the middle data point is where each person started individually on the journey. And you can see that over a year, there was close to a 10% reduction in their HbA1c. And you can see our average was quite high. We said over 75, but a lot of our people were over 100. This is 156 people. This is over 3 years. When we started, the clinic is the that 0 point, and you can see that. And this is also with 156 people. These will mean a lot more to GPs than other people, but these were indicators that we were able to achieve. So you can look at these. I'm just going to go through them, but you can see that the purple is the team that we were working with, the people we were working with, and the turquoise is all diabetics in that area. So we were reaching and meeting indicators. And this one was those people who reached the target of below 64. And you can see how that number increased dramatically over the time of the trial. And a lot of these continue to work. So I'm Leona, my colleague is Nick. I also have Vaishali here, who's our head health coach, and Rita's talking next. She's our self-management coordinator. Hopefully that's helpful. Okay?